politics, cultural exchange, social life and ecological issues. These are only few areas where international organizations implement their projects. They cooperate with public and private partners, and preserving peace for future generation is their principal goal. How do they arrange their work? What role is given to Kazakhstani initiatives? You'll find more on this in Kazakhstan International Vectors.
Right now, there's over 35 million people around the world who suffer from HIV or AIDS.
CDC has proved itself as one of the leading healthcare agencies in the world and, of course, in Central Asia. Pox. This infection was brought to the UK in the early 16th century from Arabic states. Then European ships with people and cargoes transferred this disease to Central and South America. In those times, the epidemic took the lives of about 90% of the local Indian population. So far, death toll as a result of pox throughout the world made up almost 500 million people. And only in 1967, the mass vaccination carried out by international organizations began. Another ancient disease survived till our times is tuberculosis. Since the 1600s and during the next 200 years, each seventh infected person died of this illness. In those days, it was called the Great White Plague. In the late 19th century, this disease accounted for 10% of all deaths throughout America. Cancer. Even residents of ancient Egypt died of this illness. In nowadays, oncological diseases continue to frighten people throughout the world. Annually, 7.5 million people all over the globe die as a result of cancer. Still, despite these terrible figures, this disease responds to treatment in early stages. Experts assure that different epidemics have taken more human lives than all armed conflicts put together. According to WHO statistics, more than 1 billion people annually catch various infections. The number of victims of non-infectious illnesses exceeds 36 million. Nonetheless, the last category of diseases now demonstrate the highest mortality rate. The research of experts has shown that as much as 2/3 of people die of treatable diseases. Among them can be even appendicitis. The reason is that often patients have no access to a safe and cheap surgery. The majority of such people are residents of poor countries. One more threat for such states is imported epidemics which local doctors are unable to treat. Now it is time for international organizations to help. What kind of projects can nowadays save thousands of human lives, and is it possible to predict new outbreaks of mortal virus diseases? The world statistics shows that each third hospitalized person needs blood transfusion. However, few people can afford this procedure. The reason is banal lack of blood, as only 10–15% of people can be blood donors. Whole blood is used in 25% of cases. In other situations, only some of its components are required. Plasma, which makes up 50% of blood, is most in demand. But before the transfusion, this biomaterial should be thoroughly analyzed, says Saniya Abdrahmanova. We recruit donors as well as collect, treat and test donor blood. We provide with safe blood components 23 medical institutions in Astana city. Among them are 6 major multifunctional scientific centers. In total, there are 17 such centers throughout the country. Experts think that it is enough to satisfy the domestic needs. About 300,000 blood donations are carried out in the Republic annually. According to the World Health Organization, to be independent on donor blood, each country should recruit for this purpose at least 1% of its population. Kazakhstan in general answers these standards. Only in Astana, 5% of population are blood donors. The most important thing in blood donation is donor safety, Saniya says, and adds that currently all the country's centers comply with the international standards. The work upon the creation of donor database is still underway in Kazakhstan. This system makes it possible to trace all cases of blood donations. It can also be a good contribution to safety. International organizations also make assessment, render technical assistance and provide consulting services to blood centers in different parts of the world. They help to introduce new technologies and adopt experience of foreign countries. The U.S. Centers for Disease Control and Prevention, or CDC, is an agency of the U.S. Department of Health. Its activities based on studying, providing information and assisting people in case of epidemics. It was established in 1946 in Atlanta, the state of Georgia. The organization employs more than 1,500 workers in 60 countries throughout the world.
So the Centers for Disease Control is a world-renowned, high-level scientific organization. Primarily in the United States of America, we work on preventing diseases, preventing injuries.
Experts note that medicine is one of the key factors during the estimation of living standards in different countries. Thus, in 2015, Norway, where 95% of all medical costs are covered by the government, headed this rating list. Switzerland, known as a leader in the sphere of medical innovations, is on the second place. And it is new technologies CDC is now putting emphasis on.
There are many challenges. One of the things that is a big challenge, not just in Kazakhstan, but actually all over the world, is getting up-to-date, evidence-based technology and information to healthcare workers. And so there's constantly articles coming out, new diagnosis methods.
To ensure full implementation of projects, the organization cooperates with domestic medical authorities.
We're working with the ministries of health on improving training on epidemiology. And in general, we focus mostly on collaborating with governments on preventing diseases.
Whereas now the organization is establishing contacts with different countries all over the world, earlier its activities were restricted by only one continent. However, the CDC's work was really a forced step. The history of malaria goes back centuries. Attacks of this disease were described by Hippocrates. Meanwhile, Galen noted that most of its cases occurred in summer season. In 1640, European doctors for the first time tried to defeat this illness. They also gave it its modern name. In the late 19th century, Italian zoologist Battista Grassi, within an experiment, contaminated a person with malaria through the bite of a mosquito Anopheles. In this manner, he proved that it was the way of transmission of malarial fever. Since then, the intensive studying of this disease has begun. Over the centuries, quinone extract had been considered the principal remedy against malaria. However, it had a lot of side effects. Special centers for study and research on malaria were opened throughout the world. In the US, this type of institution was opened in the middle 20th century. In general, the history of CDC begins in 1946. It was the post-war period when the agency was established in Atlanta, the state of Georgia, as the Office of Malaria Control. After its expansion, a lot of new offices were opened. Each of them carried out its own work, such as prevention or control of different infections and especially of dangerous pathogens. 10 years on, the organization started to unite with other agencies of the US Public Health Department. In 1957, it concluded an alliance with the Center for Venereal Disease Control and in 1960 with the Center for Tuberculosis Control. 3 years later, CDC starts mass vaccination campaigns and by the end of the 20th century expands the geography of its activities. International organizations report that 25% of drugs produced in Afghanistan are transported through Central Asia. According to experts, it affects the number of HIV-infected people. In some countries, 10 to 20% of injection drug users are HIV positive.
And so what we do is we have a lot of staff here and in the other countries that work together to fight diseases and make sure that we have a strong response so the next generation does not have to suffer at all from HIV/AIDS. A lot of what we've done is take the experience and the knowledge that we've gained from working in the United States and around the world.
Nowadays, the number of people with HIV or AIDS all over the world exceeds 35 million people. 1/3 of them live in Africa. The main task of the organization is to teach local specialists to reveal infected people and then help them. For this purpose, a special program has been developed. We have been working for several years within the framework of this program. We teach domestic epidemiologists how to reveal cases of especially dangerous infections. The organization's specialists emphasize that the population awareness is one of the most important factors in the battle against various diseases. Because of that, the center regularly publishes informational booklets and leaflets. We publish booklets and posters about coronaviruses, rabies, Crimean Congo hemorrhagic fever virus, and so on. Besides the provision of information to the public, the center also deals with vaccination. Recently, the US experienced an outbreak of measles. It is one of the most contagious diseases known. According to international organizations, every 4 minutes somewhere in the world a child dies from measles. It started in Southern California last December. More than 100 people had been reported affected by the disease. Experts report that measles would be a far greater threat if it weren't for the vaccine, which has now been successfully used. For the last 14 years, more than 2 billion children around the world were immunized against measles. Reducing the number of HIV and AIDS patients is also a priority for CDC. The organization's plans also include to provide a full protection to next generations against this disease.
We're actually looking at a huge decrease in the amount of people who are infected with HIV and who are affected by HIV, whether that be orphans, whether that be populations that are very vulnerable to HIV. So I believe that with the team that we've created around the world, we've actually had a huge impact on decreasing HIV and AIDS around the world.
Along with that, the center has been educating future epidemiologists and laboratory workers for more than 10 years. Thus, students from Central Asia attend special classes in Kazakhstan within a 2-year period. The center's staff hopes that later these students will be able not only to predict but also reduce outbreaks of these diseases to zero. Specialists of the organization say that 85% of the program graduates succeed in finding good jobs. More than 1,500 CDC workers in different parts of the world, jointly with other international organizations, every day help to improve the quality of medical services as well as prevent outbreaks of various mortal epidemic diseases, save thousands of human lives, and in some countries even open hospitals and teach medical workers. Currently, 57 states around the world badly need qualified medical personnel. Only 3% of all medical officers throughout the world work in sub-Saharan Africa. In some states, there are less than 2.5 doctors per 1,000 residents. According to WHO, 2.5 million specialists are needed to correct the lack of medical staff throughout the world. It means that a number of countries are unable to provide their citizens with basic and vital health services. And it is almost inconceivable that international communities would not be involved in finding solutions of this problem. There are some diseases which do not cause any discomfort to people and, on the contrary, endow them with superhuman abilities. Thus, for instance, Dutchman Wim Hof never feels cold. The man visits the world's famous glaciers in his shorts. Recently, he spent 70 minutes in an ice bath. All that time, his skin remained warm. And the most surprising fact is that Wim has never caught cold.